It may be a global pandemic, but when it comes to individual nations, the response has been anything but uniform. While some governments were quick to implement lockdowns and mask wearing, others only reacted when the virus had already wreaked havoc. The crisis has exposed major philosophical divides over the questions like the role of government or the definition of individual responsibility. As a result, outcomes have varied greatly. But the experience of some countries has also helped shape the response of others. In this time of crisis, what can we learn from each other? Welcome to your COVID-19 special. I'm Chris Colbert in Berlin. Germany has gone into a second hard coronavirus lockdown with all non-essential shops, schools and daycares closed. The move comes after less stringent measures failed to break a second wave of infections. Now, even after months, governments still seem to be pondering over how to best battle the virus. The South American country of Uruguay seems to have found a viable way.
This year has been a stressful time for the Del Bracio Mayo family in Montevideo. Guillermo was born 2 weeks before the start of the lockdown. In itself, a joyful occasion. But they couldn't share it with anyone or get any help because Ana Cristina Del Bracio and her husband Martin, along with the children, had to go into quarantine. There was a suspected case of COVID-19 in their circle of friends.
It was terrible for us because the grandmothers couldn't come, nor could the grandfathers or my brothers. No one could come and meet the baby. It was really tough.
Now, 7 months later, the world looks very different. The borders between Uruguay and its neighbors are still closed. But the small country is so far doing well, with less than 100 deaths and only a few thousand cases overall. Although infections have now risen sharply again. Schools and universities closed for a few weeks in the spring. It was the same for shops. But now the streets are busy again. Many people voluntarily wear masks in public. There's still a need for caution, but there's also an obvious sense of relief that things are not worse than they are. The mood is also upbeat at the Pasteur Research Institute. When the pandemic started in March, they were able to respond immediately with nationwide testing. The testing kits came from these laboratories. They say the approach taken by the government helped.
I think one of the big advantages in Uruguay compared to other countries was that both the president and his coronavirus team supported our scientists right from the start so that the scientists were then able to make decisions in good time.
For decades, Uruguay has invested in its welfare state, and that appears to be paying off now in the crisis. The country is home to around 3.5 million people. Poverty is still definitely an issue in some areas and impossible to overlook in the capital. Uruguay's former president, José Mujica, is one of those credited with reducing the gap between rich and poor during his 5 years in office. He was president until 2015 and invested heavily in health, education and social welfare. Now 85 years old, he agreed to give us an interview at his home.
A certain level of prosperity allowed us to develop a social democracy. That has shaped the entire country, not only structurally and materially, but also in terms of our way of life. We are now a country known for its tolerance, where people are very civilized in their dealings with each other, also when there are differences of opinion or economic crises.
Back to the Del Bracio Mayo family. They've been enjoying meeting regularly with relatives and friends again. So what do they think is the secret of Uruguay's relative success in the crisis so far? Apart from good political decisions, they think the country just got lucky to a certain extent.
Perhaps it's a different mutation of the virus that we have here that means the cases aren't as bad as in Europe. Or perhaps it's the climate, the air and the sea. I have no idea. There must be some other reason.
A few months ago, they never thought their lives would improve again so quickly. But none of them will forget the anxious period around Guillermo's birth anytime soon.
Let's get more on the Uruguayan way and whether it can serve as a model for others with Marika Blofield. She's the director of the Latin America division at the German Institute for Global and Area Studies. She joins me via Skype from Hamburg. Welcome to DW, Marika. Latin America and the Caribbean have been heavily hit by the pandemic and its economic ramifications. What really has Uruguay done better so far to cope with the crisis?
Well, Uruguay had a better healthcare and social infrastructure going into the pandemic. And so when the pandemic hit, the government was well prepared to mobilize its state infrastructure to help with both the health response and make sure that populations were able to stay inside, shelter at home, and still feed their families. And the current government is also following Uruguay's very institutionalist tradition. A unifier has been unifying rather than divisive, and the population trusts the government, so they did as the government said. And finally, Uruguay also had a pioneering virologist who was able to, with colleagues, invent his own test, and that helped with massive, rapid testing right from the beginning. And so I think those three factors have been very important in helping Uruguay weather the pandemic much better than any other Latin American country.
So in your opinion, what is the takeaway here for other countries, particularly those that might have less money to spare for a solid healthcare system?
There is no better prevention than being well prepared also from a social infrastructure point of view. I mean, governments simply need to invest more resources in building a basic universal welfare state, which includes healthcare and emergency income provision.
Now, since November, daily new infection numbers have been rising drastically and are now peaking in Uruguay. What happened there?
Well, I think I'm not an epidemiologist, but I think what happened there is also happening in Germany, all over Europe and North America. And so Uruguay is not being spared from this second wave. I think the rates are still lower than they are in Germany, for example. I think currently ICU capacity is about 56% in Uruguay. So they're still doing okay, and I believe that they're going to announce stronger measures today. Now, they've never had a mandatory lockdown like many other Latin American countries had, and they've announced they don't plan to do that, but they do plan to exhort their citizens to behave well and responsibly through the Christmas holidays, just like Germany has done. In many ways, Uruguay's path is not so different from Germany's path.
Now, you're an expert on Latin America. What exactly needs to be done to protect people at high risk of social disadvantage during a pandemic?
You absolutely have to ensure that they have the means to stay home and isolate. And that's where there is no easy solution except investing socially more for the future. And it was a rude awakening for most of Latin America when the pandemic happened and governments told their citizens to stay home, and most citizens could not do that because they simply didn't have the means to support themselves through the pandemic. And there's been a lot of rapid state building going on in the region to try to reach these disadvantaged populations. And the governments that have done that are probably in a better position to weather the next pandemic or the next economic crisis. But it does take effort and investment. And I think that's the only way that governments can weather these pandemics without devastating human impacts.
Marika Blofield, director of the GIGA Institute for Latin America Studies. Thank you for your insights.
Thank you.
And now it is time to answer your questions about the coronavirus. Here's our science correspondent, Derek Williams.
What does the latest data say about how much schools and universities contribute to community spread?
This sounds like one question, but it's actually two. So let's split it up. Kids and schools first. There's been conflicting information on just how common transmission is among children. But in general, the current consensus is that unlike in other respiratory diseases, schools aren't really driving the spread of COVID-19. At the beginning of this week, National Geographic reported exclusively on a major news study from Iceland and said that its conclusions were that kids under 15 are only around half as likely to transmit the virus as adults are. That data hasn't been published yet, but if the report is correct, it would provide corroborating evidence for a phenomenon that many experts now accept, which is that the older a child is, the more infectious they are if they themselves contract COVID-19. We still don't really know why, but outbreaks in high schools, for example, are happening at a much higher rate than they are in elementary schools. So what about universities? Well, college students are physiologically adults, and they seem to transmit like other adults do. 20-year-olds are not the ones who are most in danger if they catch the virus, but they can apparently have a big impact on its spread in the wider community. Although it's hard to put an exact number on that impact, an analysis carried out by the New York Times showed that in communities throughout the US, for instance, deaths in counties that were home to universities and large populations of college students are consistently outstripping deaths in counties without them. But those deaths are not happening among the college students. They're happening among older people in those communities who are getting COVID-19 in greater numbers in those counties. So what the data is telling me, at least so far, is that while schools tend to reflect spread in a community, they don't drive it. Universities, on the other hand, appear to do that, possibly in a big way.